Hey lovely people out there, welcome to my YouTube channel and thanks for clicking on this video. In our previous video discussion, we mainly talked about a very important concept, and that particular concept was about our directly acting cholinomimetic agent. ये ऐसे एजेंट होते हैं जो हमारे मस्केरिनिक रिसेप्टर पे और वी कैन से निकोटिनिक रिसेप्टर पे डायरेक्टली जाके बाइंड करते हैं. Now in our today's video lecture, we are going on to our next important concept, and that particular concept is about indirectly acting cholinomimetic agent. But before going directly into our indirectly acting cholinomimetic agent, we need to understand the basic classification of our cholinomimetic agent. So when we studied the classification of our cholinergic receptor agonist, we can classify these drugs into two main categorization. The very first category is known as directly acting cholinergic receptor agonist, and the second one is known as indirectly acting cholinergic receptor agonist. Directly acting में we can further classify into two important categories. The very first one is known as choline esters and the second one is known as alkaloids. So in our previous video discussion, we completed our directly acting cholinergic receptor agonist. In our today's video lecture, we are moving on with our next important element, and that is known as indirectly acting cholinergic receptor agonist. When we talk about the indirectly acting cholinergic receptor agonist, we can further classify this into two important categories. The very first one is known as reversible indirectly acting cholinergic receptor agonist, and we have irreversible indirectly acting cholinergic receptor agonist. Now यहाँ पे we need to understand the concept of reversible and irreversible. Now how we can increase the activity, or we can say how our drugs are acting indirectly. First, let us understand that. Now here is the pictorial representation of our acetylcholine. हमने previous video lectures में discuss किया था कि how this acetylcholine is getting synthesized, how this acetylcholine is getting stored, and ultimately how this acetylcholine is getting released. Now whenever this acetylcholine is getting released, this acetylcholine will work on different muscarinic receptor, and ultimately it will show its activity. Now what do we understand by the concept of acetylcholine esterases? Now यहाँ पे जो synapse में acetylcholine present है, do you think that this acetylcholine will be present in the synapse throughout its entire life? The answer is no. ये जो synapse में acetylcholine है, it is getting metabolized by a very important enzyme, and the name of that particular enzyme is acetylcholine esterases. Now just think कि अगर हमको यहाँ पे synapse में if we want to increase the levels of acetylcholine, what we can do? We can block the activity of this particular enzyme. अगर हमने ये acetylcholine esterases की activity को अगर हमने inhibit कर दिया, do you think that this particular enzyme will be able to destroy or metabolize our acetylcholine which is present in the synapse? The answer is no. Why? Simply because we have blocked the activity of this particular enzyme. So can I say by blocking the activity of this particular enzyme, the concentration, or we can say the level of acetylcholine in the synapse is increased? Now if the concentration, or we can say the level of acetylcholine if in the synapse region is increasing, can I say more acetylcholine will work on its receptor, that is muscarinic receptor? Yes, definitely. अगर ये यहाँ पे concentration of acetylcholine अगर ज़्यादा है, definitely more acetylcholine will work on its receptor, and अगर more acetylcholine is working on its specific receptor, definitely जो cholinergic की activity है, या फिर we can say जो cholinergic system की activity है, वो बढ़ जाएगी. So what we are doing? What is the main important difference between directly acting and indirectly acting drugs? Directly acting जो drugs होते हैं, they directly go and bind to our muscarinic or we can say nicotinic receptor and directly उसको stimulate करके ये cholinergic system की activity को बढ़ाते हैं. On the other hand, when we are talking about indirectly acting cholinomimetic drugs, ये ऐसे drugs होते हैं जो डायरेक्टली रिसेप्टर पे जाके बाइंड नहीं करते. ये क्या करेंगे, एसिटाइल कोलिन का कॉन्सेंट्रेशन बढ़ाएंगे and because of that increase in the level of acetylcholine, more and more acetylcholine can bind to our muscarinic receptor and उसके वजह से जो cholinergic receptor की और we can say cholinergic system की जो एक्टिविटी है वो बढ़ जाएगी. That is why ये ऐसे ड्रग्स होते हैं जो indirectly cholinergic एक्टिविटी को बढ़ाते हैं. Hence these drugs are known as indirectly acting cholinergic receptor or we can say cholinomimetic drugs. Now what is the main important concept of reversible and irreversible? Reversible, when I say a particular drug is a reversible, that means ये जो enzyme है that is acetylcholine esterases, ये जो drug है it will bind loosely with our enzyme that is acetylcholine esterases. And when I say irreversible, that means इसका जो bonding होगा with the enzyme that will be very strong. So जो reversible जो हमारे drugs होते हैं उसकी जो एक्टिविटी है easily हम उसको reverse कर सकते हैं. On the other hand, जो irreversible drugs होते हैं they permanently block the activity or we can say inhibit the activity of our enzyme. So that is the main important difference between reversible and irreversible. Now in our today's video lecture, let us start with the concept of reversible indirectly acting or we can say these drugs are also known as anticholinesterases. Now when we talk about the basic classification of our indirectly acting drugs, we can classify these drugs into two important categories. The very first one is reversible and the second one is irreversible. Reversible can be further classified into lipid soluble and we have water soluble. Now what are the important examples of our reversible acetylcholine esterases inhibitors? We have lipid soluble drugs. For example, we have physostigmine, we have Takerin, we have donepezil, rivastigmine and we have galantamine. On the other hand, what are the few important examples of our water-soluble reversible acetylcholine esterases inhibitor? We have neostigmine, we have pyridostigmine and we have a very important drug and the name of that particular drug is hydrophonium. So let us start with a basic comparison of our lipid-soluble and water-soluble drug. Lipid soluble में let's take the example of our drug that is physostigmine and water soluble में let's take the example of the drug that is a neostigmine. Now when we compare both these drugs, we saw that the physostigmine is a natural alkaloid which is obtained from Physostigma venenosum. On the other hand, ये जो neostigmine होता है that is a synthetic drug. Now when we talk about its chemistry, physostigmine जो होता है, it is a tertiary amine and it has a good penetration through the tissues, hence it is very effective topically. On the other hand, when we say neostigmine, this neostigmine is a quaternary ammonium compound and it has a poor penetration, hence it is not useful or not effective topically. Now कोई भी अगर drug है, if it is lipid soluble, so can I say it can cross our cell membrane? Definitely, अगर जो drug है which is lipid soluble, it can pass our cell membrane. So जो भी drug lipid soluble होते हैं, it can easily pass our blood-brain barrier. इसीलिए ये जो drugs होते हैं, they are very useful in different condition. Now ये जो physostigmine होता है, it can easily cross our blood-brain barrier. It can easily cross our GIT membrane. It can easily cross our eye membrane. On the other hand, when we say a particular drug is water soluble, that means ये ऐसे drugs होते हैं जो easily हमारे cell membrane से pass नहीं होते हैं. So neostigmine on the other hand cannot pass our blood-brain barrier, it cannot pass our GIT membrane and it can also cannot pass our eye membrane. So इसीलिए यहाँ पे ये लिखा है कि जो फाइजोस्टिग्मिन है, being a tertiary amine, it has a very good penetration through the tissues. Hence, it can be used topically for different therapeutic uses. On the other hand, when I say neostigmine, neostigmine is a quaternary ammonium compound and it is having a very poor penetration. Hence, it is topically not effective. Physostigmine, being a lipid-soluble drug, it can easily cross our blood-brain barrier. Hence, it can produce both the effect, that is a central as well as peripheral side effects. On the other hand, our neostigmine is a water-soluble drug and water-soluble drugs cannot cross our blood-brain barrier. So, एक advantage ये है कि neostigmine will not produce any risk of central side effect, but definitely ये जो neostigmine है, it can produce peripheral side effects. Now, when we talk about the therapeutic usage of our physostigmine, this physostigmine can be useful in the condition of glaucoma, and the second one is can be useful in the condition of atropine poisoning. Now, why this physostigmine is useful in the condition of glaucoma? Now, in our previous video discussion, we classified our glaucoma into two important categories. The very first one is known as open angle glaucoma and the second one is known as closed angle glaucoma. Now, when we are giving physostigmine like a drug, what it will do? It will inhibit the enzyme that is acetylcholinesterase and उसके वजह से क्या होगा? जो acetylcholine का concentration है वो बढ़ जाएगा. So if we are using this physostigmine topically, what it will do? Being a lipid soluble drug, it can easily pass through our eye membrane. इसीलिए हम इसको topically use कर सकते हैं. Point number 1. Point number 2, it will increase the concentration of acetylcholine. Now, ये जो physostigmine है, what it will do? It will produce a meiotic effect. And in our previous video lecture, I told you कि जो closed angle glaucoma होता है, in that patient when we are producing meiotic effect, क्या होगा? जो pupil का size है, that will reduce. And अगर pupil का size अगर reduce होता है, definitely जो iris है, वो ज़्यादा stretch out होंगे. And because of that, a stretching of our iris muscle, जो एंगल पहले क्लोज था वो रिलेटिवली थोड़ा सा ओपन अप हो जाएगा. एंड व्हेन दिस एंगल इज गेटिंग ओपन अप, जो एक्वस ह्यूमर का ड्रेनेज है इट इज गेटिंग रिड्यूस्ड, और वी कैन से जो एक्वस ह्यूमर का ड्रेनेज है वो प्रॉपरली होगा. एंड बिकॉज ऑफ दैट प्रॉपर ड्रेनेज ऑफ एक्वस ह्यूमर, डेफिनेटली जो इंट्राऑक्यूलर प्रेशर है वो कम हो जाएगा. So it is a very important drug which can be useful in the condition of glaucoma. Now the second important use है that is atropine poisoning, that we will be dealing when we are studying about atropine. But for now, just remember in the condition of atropine poisoning, physostigmine can be used. Now when we talk about the neostigmine, neostigmine का therapeutic use है, it can be useful in the condition of post-operative urinary retention and also it can be useful in the condition of paralytic ileus. Now it is quite logical. In post-operative urinary retention, patient may after operation there is a problem of retention of the urine. So as it will increase the concentration of acetylcholine, एसिटाइलकोलिन का यूरिनरी ब्लैडर पे क्या इफेक्ट है? इट विल स्टिम्युलेट आवर M3 मस्करेनिक रिसेप्टर एंड उसके वजह से देयर विल बी कॉन्ट्रैक्शन ऑफ आवर यूरिनरी ब्लैडर एंड अल्टीमेटली इट विल ईज आउट द प्रोसेस ऑफ यूरिन आउटफ्लो. सो इट इज वेरी यूजफुल इन द कंडीशन ऑफ पोस्ट ऑपरेटिव यूरिनरी रिटेंशन. On the other hand, it can also be useful in the condition of paralytic ileus. Paralytic ileus का क्या मतलब होता है? It simply means our bowels are not properly getting contracted, or we can say जो bowel की जो movement है वो properly हो नहीं पा रही है. So when we give such kind of a drug which will increase the concentration of acetylcholine, so जो bowel movement है वो proper हो जाएगी. So it can be very useful in two important conditions. First one is post-operative urinary retention, and the second one is known as paralytic ileus. Now the second important use of a neostigmine is Myasthenia gravis. Now what is this Myasthenia gravis? We will be dealing this particular concept in detail in our next video lecture. Now let us see कि ऐसे कौन से condition है जहाँ पे we need to increase the concentration of acetylcholine. Now this picture or image is representing our brain. Now brain में एक important region होता है and that region is known as basal nucleus of Maynard. Now this basal nucleus of Maynard में it is found that there are lots and lots of cholinergic neurons. Now if I say a particular region is having lots and lots of concentration of cholinergic neurons, or we can say cholinergic nerves अगर ज़्यादा present है, that means can I say that particular region is having a very good concentration of acetylcholine? Now ये जो basal nucleus of Maynard है, it is believed that this particular region is helping in the memory. Now जो हमारे न्यूरॉन्स होते हैं as we age, कुछ पेशेंट्स में ये न्यूरॉन्स डिग्रेड होते चले जाते हैं. Now अगर ये न्यूरॉन्स डिग्रेड होते चले जा रहे हैं, that means can I say जो एसिटाइलकोलिन का कॉन्सेंट्रेशन है वो कम हो जाएगा. एंड ऐसे पेशेंट्स में इट इज वेरी कॉमनली फाउंड कि ये पेशेंट बहुत ज्यादा भूलते हैं. एंड दिस पर्टिकुलर कंडीशन when the patient is forgetting more, there is a very important term that is known as dementia, and it is very commonly found in a very important disease condition, and that particular disease condition is known as Alzhymers. Now Alzhymers के patient में we know कि acetylcholine का concentration कम है, and because of that decrease in the acetylcholine का concentration, the person is forgetting more. So हमें ऐसे पर्टिकुलर ड्रग चाहिए जो ब्रेन के अंदर जाके एसिटाइलकोलिन का कॉन्सेंट्रेशन बढ़ाए. सो फॉर दैट वी कैन यूज अवर ड्रग दैट इज फाइजोस्टिग्मिन. नाउ द क्वेश्चन इज व्हाई? बिकॉज वी नो कि ये जो फाइजोस्टिग्मिन होता है इट इज अ लिपिड सोल्यूबल ड्रग. सो हमें एसिटाइलकोलिन का कॉन्सेंट्रेशन कहाँ पे बढ़ाना है? ऑब्वियसली द आंसर इज इन द ब्रेन. So this particular drug can enter or we can say cross our blood-brain barrier, and brain में ये क्या कर सकता है? It can increase the concentration of acetylcholine. But on the other hand, can we use a neostigmine? The answer is no. Why we cannot use a neostigmine? Because ये जो neostigmine है, it is water soluble drug, and ये जो water soluble drug होते हैं, they cannot cross our blood-brain barrier. So अगर कोई ड्रग ब्लड ब्रेन बैरियर को क्रॉस ही नहीं करेगी, हाउ दैट पर्टिकुलर ड्रग विल इंक्रीज द कॉन्सेंट्रेशन ऑफ एसिटाइलकोलिन इन आवर ब्रेन? सो फाइजोस्टिग्मिन कैन बी यूज्ड. नाउ फाइजोस्टिग्मिन के साथ प्रॉब्लम क्या है? फाइजोस्टिग्मिन कैन इंक्रीज द लेवल्स ऑफ एसिटाइलकोलिन इन द ब्रेन, but it can also increase the levels of acetylcholine in the periphery, which can lead to other important side effects. Now what are these other important side effects? For example, अगर पेरीफेरी में एसिटाइलकोलिन का कॉन्सेंट्रेशन अगर बढ़ जाता है, what will be the important side effect? One side effect you can guess is bradycardia. Why bradycardia? Because we know कि our heart is very well decorated with M2 muscarinic receptor. So अगर एसिटाइलकोलिन का कॉन्सेंट्रेशन बढ़ा, this acetylcholine can stimulate our M2 muscarinic receptor which is present on our human heart. उसके वजह से जो हार्ट रेट है वो कम हो सकती है, and also it can reduce the atrioventricular node का जो कंडक्शन है वो भी कम कर सकती है, and also by reducing the heart rate कुछ हद तक ये ब्लड प्रेशर को भी कम कर सकती है. So that is one important side effect. If you stimulate the muscarinic receptor and increase the bowel activity, what can be the side effect? The side effect can be diarrhea. If you stimulate the M3 muscarinic receptor which is present on our urinary bladder, वहां पे क्या हो सकता है? Patient will have frequent urination problem. So हमें ट्रीट क्या करना था? हमें अल्जाइमर्स को ट्रीट करना था. अल्जाइमर्स के ट्रीटमेंट के लिए we need to increase the concentration of acetylcholine inside our brain. बट ब्रेन में तो हमने एक पर्टिकुलर साइड इफेक्ट दैट इज ऑफ डिमेंशिया या फिर अल्जाइमर की कंडीशन तो हमने थोड़े हद तक ठीक कर ली, बट बिकॉज ऑफ दिस अदर साइड इफेक्ट देयर कैन बी प्रॉब्लम. सो हमें कुछ ऐसा ड्रग चाहिए जो मेजॉरिटी ब्रेन में जाए एंड पेरिफेरी में अगर ये ड्रग कम होगा इट विल नॉट इंक्रीज दैट मच अमाउंट ऑफ एसिटाइलकोलिन. So physostigmine increases the levels of acetylcholine in the brain, but also it increases the levels of acetylcholine in the periphery. And because of this increase in the level of acetylcholine in the periphery, there can be other side effect. So इसको tackle करने के लिए we can use one more important drug, and the name of that particular drug is Takerin. Now Takerin का advantage क्या है? Majority of this particular drug goes inside our human brain. So अगर majority ये जो drug है अगर brain में जा रही है, so can I say there will be relatively lesser peripheral side effects? Why? Because अगर majority drug हमारे brain में जा रही है, so peripheral region में the concentration of this particular drug will be reduced. And अगर concentration of a drug अगर periphery में कम है, so can I say relatively जो acetylcholine का concentration है वो इतना ज्यादा नहीं बढ़ पाएगा. So जो बाकी के जो side effects थे that were mainly produced by physostigmine that can be reduced. But Takerin के साथ और एक important problem है. The problem with Takerin is it requires frequent dosing requirement and it is hepatotoxic. Now frequent dosing requirement, why it is a problem? हम ये जो ड्रग है दैट इज अ टैक्रिन वो हम कौन से पेशेंट में दे रहे हैं? द आंसर इज वी आर गिविंग दिस पर्टिकुलर ड्रग इन द ट्रीटमेंट ऑफ अल्जाइमर्स डिजीज. तो अल्जाइमर वाला जो पेशेंट है ऑलरेडी दैट पर्टिकुलर पेशेंट इज फॉरगेटिंग थिंग्स. सो अगर आप ऐसी ड्रग प्रिस्क्राइब कर रहे हो, फॉर एग्जाम्पल इफ यू आर गिविंग अ ड्रग जो वो पेशेंट को 4 बार खानी है, सो हो सकता है वो पेशेंट भूल जाए because the underlying जो main important side effect है of the Alzheimer disease that is the patient is forgetting. So यहाँ पे frequent जो dosing requirement है that can be a problem. And the second problem is ये जो drug है it is hepatotoxic. Now यही दो side effect को tackle करने के लिए we mainly use further important drugs to solve the problems of a Takerin. Following drugs are used. The very first important drug which can be used is donepezil. The second one is rivastigmine and the third one is galantamine. So ये जो drug है they are having all the properties similar to that of the Takerin. Now when I say all the other properties are similar to that of Takerin, what I mean to say is कि Takerin का जो majority जो हिस्सा है that was going into the brain. So ये जो ड्रग है यहाँ पे भी जो मेजॉरिटी जो कॉन्सेंट्रेशन ऑफ अ ड्रग है दैट इज गोइंग इनसाइड द ब्रेन. मेजॉरिटी अगर ब्रेन में ड्रग जा रही है, सो कैन आई से रिलेटिवली जो पेरिफेरी में ड्रग का कॉन्सेंट्रेशन होगा वो कम होगा. एंड बिकॉज ऑफ दैट लेसर कॉन्सेंट्रेशन ऑफ अ ड्रग इन द पेरिफेरी जो पेरिफेरल साइड इफेक्ट है वो कम रहेंगे. एंड मोर ओवर ये जो 3 इंपॉर्टेंट ड्रग्स है दे आर नॉट हैविंग द प्रॉब्लम ऑफ frequent dosing requirement and also these drugs are not hepatotoxic. So जो problem Takerin में थी that was of frequent dosing requirement and hepatotoxic is overcome by the use of these 3 important drugs. And ये तीनों जो drug है they can be useful in the condition of Alzheimer's disease. So that's it for today's video lecture. अगर आपने यहाँ तक वीडियो लेक्चर देखा है, please consider subscribing to my YouTube channel. Press that bell icon, like this video and share it with your friend. In our next video lecture, we are going to understand a very important concept and that is of Myasthenia Gravis and drugs which are useful in the condition of Myasthenia Gravis. So see you in the next video lecture. Till then, see ya, bye bye, have a good day.